590 WKZL. 8:37. November is National Diabetes Awareness Month, and kind of hits home when you have type 2 or type 1 diabetes. I have type 2, so it's important that this education gets out. It's time for our Bronson Health Chat, and we're joined by Pamela Miller, who's a nurse practitioner at the Bronson Diabetes and Endocrinology Center in Kalamazoo and the Bronson Battle Creek Diabetes Education Center in Battle Creek. Good morning. How are you?
Good morning. I am fine.
Good. Me too. Now that everybody now that we know I have type 2, I'm much better now. Thank you.
Okay.
It took a while though. We hear about type 1, we hear about type 2. Pamela, what's the difference between the two?
Well, type 1 diabetes, it used to be called juvenile onset, but it occurs most often with children or young adults, and they produce little or no insulin, so their treatment is insulin. Type 2 diabetes, however, used to be called adult onset because we used to only see it in adults, but now, unfortunately, we're seeing that in our younger population, like kids, because of the obesity rate. They can start out with management like that four-letter word diet, weight loss, and then sometimes progress on to needing pills or oral medications, maybe even non-insulin injectables, and then maybe eventually insulin. So just because you're on insulin doesn't mean you have type 1 diabetes, but type 1 diabetes patients have to have insulin because they can't produce it.
Yeah, I know I'm a type 2 and I do take insulin, but it's, I had that explained to me that it's the flexibility has gotten a lot more, diverse, as time goes on. All right. So if I'm sitting out there and I'm thinking, I wonder if I happen to have diabetes, what are some of the risk factors?
Well, the risk factors include, one of the strongest ones is your family history, like if you had a mom or a dad or a brother or sister. Ethnicity is a strong risk factor. For instance, African American Indians especially have the highest rate of diabetes type 2, Hispanic, and even our Pacific Islanders. So ethnicity can be a risk factor. Obesity and our sedentary lifestyles are risk factors. And then if you had gestational diabetes, which is diabetes when you're a pregnancy or a baby over 9 pounds, that's a risk factor. And then our age, because we tend to wear out as we get older, so that can be a risk factor.
We're talking with Pamela Miller, who's a nurse practitioner at Bronson Healthcare. If you want to know, how does somebody know they might have diabetes? What are some of the specific symptoms?
Well, the symptoms can be sort of subtle with type 2. They can sort of creep up on you, and they can be sort of vague. Now, with type 1 diabetes, usually you're pretty sick and losing weight and getting dehydrated and usually pretty sick, and a lot of times end up in the ER or the hospital. Type 2, however, which is the more prevalent of all the diabetes, the symptoms are more subtle. You might have some fatigue, which we all have because of our work schedule, etc., some thirst, increased urination. And one of them also that I see a lot is maybe an infection or a sore that's just not wanting to heal up very easily.
If it's not treated properly, what are some of the complications of diabetes?
Well, I like the phrase diabetes is the cause of nothing, but uncontrolled diabetes can lead to those complications. So, and those would include the most common things that we hear, like cardiovascular problems like heart and stroke, or circulation to the legs being impaired or affected. The kidneys, we all hear about chronic kidney disease and how diabetes affects the kidneys or could lead to kidney failure. And blindness, the retinopathy, the disease of the eyes or the vision. And then we all hear about the amputations or the toe infection that didn't want to heal up. But again, diabetes is the cause of nothing, but uncontrolled diabetes can be the cause of those complications.
Yeah, we just had a Hall of Fame baseball player, Lou Brock, had a amputation below the knee because of diabetes complications. So, it does happen. One of the things, and this is something that my doctor has hammered home to me any number of times, It's this little phrase called A1C. What exactly is the A1C?
Well, the A1C is a way to sort of judge how well controlled your diabetes. It's a 3-month test, and a lot of patients don't understand why can I only have it 3 months. Well, it's based on the red blood cells, and the red blood cells live for about 3 months in our system, and then our body system replenishes them. And what happens with diabetes is the sugar sticks to those red blood cells, and then the lab has a way of measuring how many red blood cells are actually sugar, sort of, to put it simply, sugar-coated, and then they come out with a percentage. And that percentage can be, like 7% is equal to an estimated average glucose of around 154. So you can sort of gauge how well you're doing every 3 months. As far as your diabetes control.
I always wanted to know why every 3 months. I should have asked, but now I know, which is cool.
Yes.
Now, my A1C is 7.2 now, and I have been told that you never get cured, but is it possible to move yourself from diabetes to under control or to a metabolic disorder area? Or, can you get rid of it?
Well, you put it in remission, so to speak. Once you have diabetes, you have it. You do the things you need to do to control the diabetes, like weight loss, exercise. If you have to take medications, that can certainly control it. But if you quit doing those things, it's going to be back. Same way with bariatric surgery can put diabetes in remission, but you gain the weight back, the diabetes is back.
Yeah, it's amazing how we have so much control. It's just the medical advances have been just awesome. And again, because I have a personal stake in it, it's been amazing to see what's going on. It is your personal attitude. My doctor told me, and the nurses, personal attitude can be one of the best preventive measures as far as diabetes goes. But if somebody's out there and they're thinking, you know what, I need more information about this, or I need more. I need more guidance, or whether how can they benefit from the services at Bronson?
Well, our Diabetes and Endocrinology Center is here. We have a staff of registered dietitians and certified diabetic educators, CDEs, as well as the healthcare providers, Dr. Corin, the endocrinologist, and myself. And we would need a referral from the doctor, that person's family doctor. But I also encourage patients to get on the ADA website, diabetes.org. There is a ton of information on that website, from risk factor tests to see how high your risk factors are, diet, that 4-letter word again, that meal planning, and some recipes.
I'm going to tell you from personal standpoint, you need to go on. You need to see what the symptoms are. If you think you might have them, you need to contact your doctor like ASAP. The sooner you determine if you do have type 2 or type 1 diabetes, and you'd know, if, like you said, Pamela, you'd know if you had type 1, but type 2 is kind of sneaky. My doctor actually believed that I may have had it for a year before I actually was diagnosed with it. So the sooner it happens, the sooner you get into treatment, the sooner you can control it, and the better off you're going to be, because it's a controllable disease, but you have to want to do it. So again, how can people contact you?
Well, our office number is 269-341-8585.
Pamela Miller, nurse practitioner at Bronson Diabetes and Endocrinology Center in Kalamazoo, and the Bronson Battle Creek Diabetes Education Center in Battle Creek. This is National Diabetes Awareness Month. Be aware. Pamela, thank you so much for coming on with us today and talking about a subject that needs to be talked about, and hope to talk to you again soon.
Okay, thank you.
Thank you, Pamela Miller, in our Bronson Health Chat.